As I said, in the Insight Forum, we deal with altered states of consciousness, everything around it, in medicine, research, society, and culture. And what more important than people? So we try to explore all of the different perspectives onto topics that are relevant in this field. And that's why tonight also we invited Julia. I think we met briefly at ICPR conference in the Netherlands last year. Heard your talk and thought this person has to come to the Insight Forum. Oftentimes we talk about psychiatry and what needs to change in psychiatry. We talk about holistic milieux and sociological talk, about philosophy and culture. We don't talk so much about the human body and how that is sometimes quite neglected actually in clinical trials with psychedelics, because we are not all identical, obviously, right? So there's so much intuitively true, but not all of it that should be recognized is actually taken into account when designing studies with people. And phenomenology, so the lived experience that they go through. So that's why we have Julia here tonight to shed some light on overlooked connections between, for example, hormonal cycles. I got a sign there, so sorry, I had to do this. Reproductive phenomenology and altered states of consciousness. Are people on that saying they can't hear me?
Yes.
Okay, so we'll talk quietly, but into the microphone. Sorry, I'm not trying to be funny, but we just always have technical issues, and it's like a running gag in our group here. So the discussion tonight, this centers on the research gaps that are related to the commonly female-associated embodiments, such as pregnancy, menstruation, menopause. We do recognize that gender and identity are deeply complex. And while many of us have a certain degree of interdisciplinary training, and even this open format of a forum, which is a public space, discussion of knowledge transfer, cannot really do justice for this complex topic or comprehensively address this. So while we will learn a lot tonight, this will not be everything, obviously. And so the aim is not to exclude any experiences here, but rather address a specific area of scientific neglect, something that has been much overlooked in science. And that still has real-world implications for medical research, psychedelic-assisted therapy, but also the lived world experience of many humans worldwide. So we hope that this conversation tonight serves as a stepping stone to broader discussions on gender, embodiment, psychedelics, and in the future we'll build together an ethical approach of consciousness and establish safe and legal frameworks where the use of psychedelic substances can take place in societies. So tonight I encourage you to engage critically, ask questions, contribute, and really learn together and have an open mind. So with that, finally, I'm honored to welcome and then introduce our guest, Julia Mándoki, who I think is a rising star in this science and technology studies area, I think I would also call it. She's an activist, an artist, an independent researcher of Hungarian origin, and is based in Amsterdam. Julia's work is driven by inclusive dialogues aimed at positive social change, rooted in the exploration of consciousness and art. Now, with an academic foundation in religious studies, she incorporates insights from the social sciences and philosophy of her approach. Currently, she's working with 2 international NGOs and addressing global health disparities and promoting reproductive rights and accessible healthcare for women. Thank you, Julia. Now the stage is yours.
Hello, everyone online. I was just saying that today we're going to talk about the complexity of gender and what that means for the state of consciousness, but also very practically what does that mean for science practices and for clinical trials. And I'm going to take you through what we're going to do today. I'm going to start with defining my terminologies. What do I mean when I use all of these words? We're going to talk about some histories that we don't really recite in psychedelic communities. And then I will also explain the concept about psychological patriarchy, which is important to then better understand how complex the different gender biases are. We will also talk about non-ordinary phenomenologies and cyclical realities. This is kind of the storytelling part, where I want to introduce you to some non-ordinary perspectives on bodies. And I'm going to talk about essentialism in psychiatry and feminist bioethics. But before we're going through this, I want to start with a little question. What do you think Albert Hoffman and a medieval midwife might have in common? Yeah, you know it already.
They were interested in Mutterkorn.
Yes, exactly. Thank you. Mutterkorn. That's a German word for ergot. That's this fungi that grows on this brain. Also in Hungarian it's called anyaros, and in Dutch it's called Mutterkorn, so the term mother is in there. So that's the term for ergots. Ergots, as you all know, Albert Hoffman synthesized LSD out of ergot alkaloids, and the interesting thing is that, which the name also tells us, that the knowledge about ergot alkaloids was in the hands of women, and it was used for a wide range of obstetric purposes, to save women's lives, to prevent postnatal hemorrhage, or to induce abortions, or help with miscarriages, because ergot has labor-inducing properties. So also when Albert Hoffman started to research on this compound, they were actually working on a medication called Gynorex, and it was a medication that was then used in obstetric medicine. All right, the definitions. So when I use the term woman, feminine, or female body, it's very important for me to say that this is a constructed term and is culture and context dependent. These terms, gender terminologies, are actually defined by a multi-dimensional space and a big notion of fluidity. And I will later explain why, and why we also have science, and especially neuroscience, that also confirms that gender is a cultural construct. I want everyone with a uterus, or people who identify as, to be included when I use these terms. So what are the two issues we're going to navigate? Gender blindness and gender bias. So patriarchal cultures of science, which is the current episode we're living in collectively, is kind of framed by these two issues when it comes to gender neglect and gender oppression. Gender blindness being the bypassing of any kind of difference category or variable that's related to sex and gender, and that manifests in androcentrism. Androcentrism is the idea that man alone can represent humanity as a whole. And that applies also for technical aspects and for science methodology. Gender bias, these two kind of birth and feed each other. Gender bias is the general favoritism or prejudice against a gender, often manifesting in unconscious or systematic ways, again, resulting in androcentrism. Thinking that subconsciously, that's very structural, that the male archetype or the male reality is the healthy one, the stronger one, and the normal one. That's the bias mechanism that we also want to look at today. What do we need for that? Feminism. Well, feminism is actually really fun, and it's really, really psychedelic. There's a lot of feminisms, like there's more feminisms than psychoactive compounds, and they partially overlap and partially they disagree with each other. But overall, you could say that feminism is an analysis, theoretical and practical, that is critical towards hierarchical imbalances operating within patriarchal cultures. I will use two types of feminism for today. I will first start with ecofeminism. And in order to pay respect to Zoe Helene, who was the first one who coined the term psychedelic feminism, and she used ecofeminism as a method to explain her thoughts. And later, I will use intersectional feminism when I talk about the clinical applications of gender studies. What is this patriarchy that I just mentioned? It's one of my favorite definitions by Bell Hooks, which also really shows us that patriarchy has nothing to do in the first sense of interpersonal male-female relationships. It's an entire social political system in which psychological violence is used, to maintain dominance over those deemed inferior or weak, not only by patriarchal men, but everybody who participates, whether consciously or not, in institutions characterized by domination and power. Yeah, I love this definition because it opens so much space for creative thoughts and also brings us close together when we talk about difficult histories of oppression and different experiences of how this manifests for all of us today. And now I want to talk about one of the feminisms I'm using, ecofeminism. And I'm going to use this brilliant work that really, I think, is suited also for the psychedelic discussion, especially when we talk about phenomenology and framing and culture. So in her work, Carolyn Marchand historically breaks down how she sees the scientific revolution and the industrial revolution took place through the oppression of femininity and women. She analyzes literature and art and looks at how science got framed in different ways. So she starts by seeing this hermetic worldview where feminine is associated with being close to nature, very natural, and there are these two dominating archetypes, nature as the giving motherly force, but also the destructive force, the storm, the thunder. But in all cases, it would be nature. So feminine was associated with nature, with the earthly realms. And then in the Renaissance, especially in later stages, there's more and more in the literature, she's noticing that nature is seen not as a divine feminine force, but as disorder, something that needs to be controlled and that is disorganized. That goes parallel with a social development and a political development that is quite tragic, which tells the story of one of the greatest genocides in European and Western history, which were the witch trials. So women were accused to disrupt social orders with sex magic against men, and possessing obstetrical skills, and for using hallucinogenic substances specifically. That was one of the many reasons why a lot of innocent women and herbalists, and most likely queer people as well, were accused of disrupting social order and were followed by deadly persecution. The Hammer of the Witches was written in the late 1500s in Germany, and was followed by a distribution of mass femicides, really manifesting in the demonization and the abolition of herbalism, reproductive autonomy and the knowledge about reproductive autonomy, femininity in women. So the knowledge was taken away from the lay people about how to control their bodies, but also how to control their states of mind, because a lot of these herbal medicines, we have a lot of ethnobotanic proof. Great writers, Christian Rech, whom I've known personally and learned a lot from, that hallucinogenic substances were used by these herbalists, these lay herbalists. And this knowledge was systematically destroyed in order to institutionalize knowledge. So it was not just the institutionalization of knowledge, but also this is important for us to reflect, because these health ontologies that were introduced then is what we still use today, partially. We will see how. So the organismic worldview, according to Carolyn Marchand, was undermined by a mechanistic worldview, where the material reality is that matter that we are able to control, manipulate, or judge with our minds. So, in other words, Cartesian dualism was further introduced after these historic developments. Valerie Plumwood, also an ecofeminist, calls this the master model of rationality in Western culture. And a lot of feminist historians also say that this laid the foundation, the philosophical foundation, but also the political one, for capitalist industrial complexes to evolve, and also to introduce the binary functional gender stereotype, the male-female idea of the two opposite binary genders that have both a fixed function and role of behavior in society. Right. So mind over bodies is, and that was all necessary to later start the Industrial Revolution, where it's very important to have strong gender stereotypes and to introduce the nuclear family. What does it have to do with today? So that's one way to understand patriarchy and the scientific ontologies that we're using. And coming back to psychological patriarchy, which I think is something very interesting if we think about psychedelics, because psychedelics usually kind of make everything very fluid and non-binary, and it helps to understand the concept and history of psychological patriarchy. So this is defined by vertical hierarchies of dominance, as we already heard. On the external level, it manifests in the superiority performed by actions of classism, sexism, racism, ableism, and also anthropocentrism, thinking that we're better than other species. So that kind of vertical top-down idea of value. That goes, of course, only together with the normalization of institutionalized power. And that needs essentialism. Can further manifest in neurocentrism, reductionisms, etc., etc. There's different notions of essentialism and reductionism in science and in literature that are needed to uphold these kind of ways of making meaning. Internally, this can of course manifest when we look at the mind over body idea or the subjugation of inner vulnerabilities. And in psychedelic contexts, and we'll come back to it later, this also means that the patriarchy is kind of the set and setting that we're all in, no matter our gender. And this is especially important because mental health for men, which is a whole presentation that is also missing in our scientific community, especially in psychedelics, there's so much to be said about mental health care for men specifically because the subjugation of inner vulnerabilities has a lot of devastating consequences for men's mental well-being. Dichotomies and binary logic. Something that is also being challenged often during psychedelic experiences, as you may agree. So, I don't want to repeat myself too often. In order to uphold the system of logic, of course you need to categorize reality, right? You need to categorize value, and you need oppositions, you need binary models of logic. And the verticalization of transcendence goes with that, and the fetishization of ascendance. So the whole idea that we ascend from the earth to the deadly, to the holy Father Sky. Sorry, Freudian stuff. The whole idea to ascend from earth in order to get purified. That is this phallocentric idea of needing to go away from something that's a natural disorder. Health is defined as a state of mind of control over symptoms rather than a state of synergy with the environment, which is also opposing a lot of health ontologies that we know from indigenous communities. All right, I'm going to quote one of my favorite men, Terence McKenna. Patriarchy has been at war with entheogens. Entheogenic experiences make the maintenance of rigid hierarchies unsustainable. That poses major threats to patriarchy. So, back in the earlier episodes of psychedelic research, patriarchy was well discussed, especially Terence McKenna. Actually, I had to choose the right quote because he used the term quite often. And now I want to talk about one of the most unspoken boundary dissolutions. And this starts at the very beginning of all of our lives, where we are literally sharing our existence in the same space with another creature. So this is, for me, this is on a phenomenological level, one of the most important boundary dissolutions. And I want to talk about birthing consciousness because psychedelic literature has a history as well in the West, and Rick Strassman or Stanislav Grof have talked about birthing. And we hear the term psychedelic rebirth a lot, whether it's from individuals or in the literature. But what they unfortunately never did was to really talk to women and actually think about birthing, and not just being born, but actually the process of birthing and the consciousness of it, the experience of it. So I want to talk about it. There are some phenomenological parallels, and it's very important for me to also say that this is not a truth. This is a phenomenological mapping that I'm going to do now. So there's the sensory and boundary dissolution. So the direct knowledge of the self as the other. You could also call that an internal entity encounter. It's also true for abortions and miscarriages, where you have the encounter with another potential life form. That is really psychedelic, if you ask me. Of course, this can result in interconnectedness and unity experiences, but also is a very polar experience, means it can be traumatizing or very empowering. More parallels. Existential transformation. So, again, psychedelic death and rebirth, and the whole embodiment of physical and psychological intensity that is so non-ordinary, that a rite of passage is a conclusion of these experiences, because you are never the same person before or after. It's very similar again to psychedelics. There's the adaptation and the integration of new identities, in this case, parenthood. What kind of evidence do we have for this? Well, not so much, because no one really interviewed women. There were a lot of efforts to trying to measure the brains of newborns and to figure out how birth consciousness works, but women as agents of the experience were unfortunately neglected up until recently. In a bit, I'll show you some exciting studies about it that were just published last year. Here I have some anecdotal reference. I'll just read out one of them. This was collected from different writers who had, female writers in the psychedelic scene who had given birth and wrote articles about it, how that sort of felt very similar. It was getting us both very high. In fact, everybody in the room looked golden to me. Valerie, Amber, and I hung out and kind of melted into each other and fell in love. No wonder. Birthing people enter something that's called the labor land, which is just this extreme storm of neurochemical modulations, high levels of dopamine, serotonin, but also morphines and oxytocin, a very interesting substance that we know from MDMA. This is a study that I found highly interesting. It talks about oxytocin. And it looks at birth as a neuropsychosocial event. And this is a quote, and this is not a psychedelic paper. It says, "The spontaneous altered states of consciousness that some women experience may well be a hallmark of physiological childbirth in humans." Why? Because the push of the fetus against the cervix is creating a feedback loop to the brain where high levels of oxytocin are actually necessary to stretch the cervix physiologically. So that is very untalked about in the psychedelic community, but there's this unique moment where human adults have this high amount of endogenous oxytocin production. That's at the very start of our incarnation. What else is there? The study came up last year, women's neuroplasticity during gestation, childbirth, and postpartum. This was a first study one of a kind, where they were actually doing brain scans to see what's going on before and right after giving birth. And what they found is that there's this unique high amount of neuroplasticity of new parents. Interestingly, side fact, also the male partners who were part of birth had high amounts of neuroplasticity that were unusual. So there's a phenomenologist, Oli Dahan, who also hypothesizes transient hyperfrontality, something we heard often in psychedelic science. So she goes even further. She kind of compares the two states and is looking for arguments how we can actually learn from psychedelic science to improve birth practices. And she says that because of the high similar elements, we can learn from the two disciplines, because birthing people are very sensitive to set and setting and undergo these extreme states. So there's this transfer. I have to share the resources if you're more interested. This is just a summary now. So we have the neurobiological parallels, neuroplasticity, possible transient hyperfertility, neurochemical modulations, extreme states, existential parallels, rite of passage, and boundary dissolutions, vulnerability to certain setting, and nonlinear and cyclical realities. What does that mean? You may have seen this before in your life, hopefully. This is a simplified graph of a menstrual cycle. Not all menstrual cycles are 20-day long. Very important. Cyclical realities and nonlinear realities. When I look at this graph and I think about psychedelics, I think about this idea of onset, peak, and drop, and these kind of circular motions that are hard to control, very hard to predict, and very context and person dependent. So, in the past 2 years, only papers are published on menstruation that bring a little bit more light to this phenomenon, what it means for cognition and perception. Several studies have indicated a correlation between estrogen and serotonin levels during the menstrual cycle. During the follicular phase, when there is an abundance of estrogen, there is an increase in serotonin levels. The opposite has been seen during the luteal phase, where estrogen levels are low and progesterone levels are high. There's a decrease in serotonin levels. Well, this is one hypothesized mechanism. What does that mean for psychedelics? Well, here's another paper that's kind of it does a big literature review, because there's very little menstrual science that we can fall back on. So this is literally just starting. This came out in March last year. By unraveling the complexity of estradiol's impact on neurotransmitter regulation, this review contributes to advancing the field and lays groundwork for future research aimed at redefining understanding of the relationship between estradiol and neural circuits. So there is a relationship, but it's not really known how it can be predicted and applied to clinical contexts yet. What else is there that we don't talk about in psychedelic science? Not just the hormones and the neurotransmitters that seem to have something that we should look at maybe. There's also some hints that show us that maybe psychedelics impact the uterus directly. So, as we've already seen at the beginning, ergot alkaloids, the history of the medical use of them. But then there's a very interesting paper that really sparked my interest long before it appeared, because these are actually whispers that you have in the psychedelic underground, but also the indigenous communities of knowledge that classic psychedelics can actually induce a menstruation. And then Natalie Gokashian published this case study where she writes to Anna 3 women explain their experience of it. So there's no research, there's no data, but we have anecdotal references from these case studies. And yeah, if you maybe later can have conversations and ask people with a uterus, did you ever experience this? Maybe you can find out something interesting. Because what she found is that menstrual changes can come after the intake of classic psychedelics. There's another evidence that points towards the same direction. Mescaline as a possible vascular contraction of the uterus and enhances secretion of prolactin. So there's again this hint that classic psychedelic could impact female reproductive system. Belladonna is a uterine muscle relaxing drug. So these are the things that I just found looking up myself. The influence of microdosing with psychedelics on menstrual-related symptoms, that's ongoing at the moment. So as we speak, these things are being recognized and looked at, though mostly for the issue of mood stabilization, not so much to understand this mechanism. Nevertheless, this is going on in masters at the moment. So these are hypothesized mechanisms that are under-researched, but in my opinion, should be looked at. Why should this be looked at? Because psychopharmacology, which is of course a a related sibling of the psychedelic research field, also talks about this. Because the idea of sex being just ignored as a variable is problematic in many fields of medicine. So women represent the majority of patients with psychiatric diagnosis and also the largest users of psychotropic drugs, especially antidepressants. More women than men take multiple medications and are more vulnerable to a number of adverse drug reactions. The reasons for this increased risk include gender-related differences in pharmacokinetic, immunological, and hormonal factors. So this graph is something I got from this paper. This was also just published, so all of this is maybe 1 or 2 years old, these kind of thoughts. And it's not just hormones. There's a lot of different factors: immune system, metabolism, genetics. One of the most important ones that we're going to talk about more now is habits and the gendered realities that might be even more complex than the whole genetic ones, and also the ones that relate to hormones. Also the idea, we see the bias in this graph, right? We have the pink and the blue here again, which is of course not a crime, but it is a gender bias. It's important to recognize it across all disciplines. Why? Because it implies that women have estrogen and male have testosterone, which is a scientific bias. It's not true. Both genders and all genders beyond male and women have estrogen and testosterone. And often you cannot distinguish the levels. So it's so diverse that, there's a whole new stream in neuroscience and social endocrinology that wants to discuss whether you can really just measure hormones and say this is the gender X, Y, Z. Because it's actually more difficult than we thought. Again, look up this paper. Keep in mind sex differences when prescribing psychotropic drugs. Great paper. I find it very inspirational for psychedelic questions. Now I'm going to talk about the elephant in the room, the gender data gap. Maybe you heard, who heard about the gender data gap? Oh yeah, it's 1.5. Really great. So I'm going to fly through this one. So the introduction of a standard person for medical research was done in 1920 by the National Institute of Health, which was a white man. And women were only necessary to be included in 1993. Before that, you could just exclude women and be like, men can represent the lived and biological and pharmacological reality of all humankind, which of course led to a series of adverse drug reactions and a lot of harmful realities for women. Unfortunately, I had to add another point to my slide last week because since 2 weeks, the National Institute of Health policy for gender inclusive science is no longer accessible and is no longer needed to be applied under the Trump administration. So we just want to say this, that we're going backwards at the moment when we look at the States. The British guideline is still online and it's also still legally, it's still applied, but under the Trump administration, it's just important to know that a lot of gender inclusivity guidelines were deleted. So usually I also look at them for deeper work, and I realized I couldn't access them anymore, and then, happy to talk about it later. Problem is, if we leave out these guidelines, we get partially false and harmful study results that are being replicated over and over again, and also go into technological development, resulting in women having twice higher risk to be misdiagnosed, followed by cardiac arrests, or have twice as likely a chance to have adverse drug reactions. And then there's the prediction that AI will even magnify this because it is kind of trained on these biased data sets. And this also is true for precision medicine and precision psychiatry. What does that mean for psychedelics? Well, I gathered my 4 main ideas that I would say are relevant in this discussion when we look at biological differences and pharmacological implications. So there's the impact of neuroactive sex steroids on mindset, experience, and metabolism. So we simply cannot say how much the fluctuations of the different sex hormones maybe impact the setting and the physical reality, but also the personal reality, emotional, psychological of a person. We don't know that, but also we don't know how it interferes maybe with the experience itself or the metabolism of the drug. So that's an interesting thing to think about. Second point, gender-blind approaches to dosing is kind of a result out of it. So we also don't really have enough research or elaboration on the issue of dosing and gender in psychedelic science. Then there's also the idea that all of this complex variables have an impact on different stress responses. Doesn't mean that women have this different stress response all along with males, but there might be differences on the spectrum for different kind of people. And a lot of this is at the moment ignored in psychedelic literature. And then of course the changes in the menstrual cycle, which is critical because we also want to ensure that psychedelic medicines stay safe for everyone and they don't interfere with hormonal cycles in a destructive way or in a disruptive way. So the question is, do we need control trials? Do we need to figure this out? This has actually been done once. A female neurobiologist did a control study for amphetamines, so not classic psychedelic research, but for amphetamines, looking at the different moments of the cycle, of the menstrual cycle, and how it's being metabolized differently, and whether it's changing the cycle. Yeah, so the idea of having control trials and to really generate data sets that are then applicable is an important question to ask. Of course, what we can already do now, which has already been done partially, is the collection of menstrual data. Also the problem that there's no consensus in the psychedelic research community of how much data and how, and when, and where do we process it, what do we compare it to. So yeah, we need the last menstrual periods, the LMP of clinical trial participants, but also PhD participants. And maybe even field researchers is relevant. So I definitely encourage anyone to just collect this data. To always just know where you are in the menstrual cycle, basically. Then, of course, together with follow-ups and mixed method approaches, so not just the dates and the amount, but also maybe what was experienced and felt on a qualitative level. Is menstruation a pathology? Is it something bad? Is the question. And it's an important question to ask, actually, because there's also a lot of initiatives that want to treat women out of their menstruation experience because of the dips of serotonin. Again, this is historically under-researched, so we don't really know what it all means. And less than 1% of the research in healthcare fund goes to understand women's health. But why is that important? How actual is this? Well, 70 to 90% of all menstruating people are experiencing something called PMS, at least once in their life. PMS has a list of many dozens of symptoms of mood destabilizations, but also more severe conditions, which would then result in PMDD, which is part of the DSM. 5 to 8% is said to suffer from PMDD, which is a very critical condition where there's a high rate for suicidality and strong states of anxiety and depression. How real is this? Well, for 5 to 14 days a month, 12 months a year, for more than half the world's population. So I would say it's quite a real reality, even though we don't talk about it. I remember when this summer I presented this at a conference, and our colleague who was on the team was like, yeah, it's great that you're here, even though your topic is a bit unusual. And I'm just like looking at this and I'm like, why is it unusual? Like, we're all menstruate, you know, and we all come from a menstruation at some point, regardless of our gender. So I think it's not so much of a strange topic. I think it's great we talk about it. And we also gain more scientific interest. So Psychedelics, some people say, could be supportive in the treatment of PMS, PMDD, but also menopausal symptoms where you also have these big dips of estrogen and serotonin. Perinatal disorders, PTSD, cause very reproductive trauma. So these are all the things that psychedelics could maybe even contribute to these experiences. Well, psychedelics could interfere with hormonal cycles, but also hormonal cycles could interfere with psychedelics. Smells like we need more research. Because the history of science, especially the history of psychiatry, of Western psychiatry, has actually been quite bad with women and with menstruations. So the idea that menstruation is something bad, or also the cyclical experience of mood that also comes with pregnancy and menopause, was pathologized. And no other example shows that better than hysteria. So hysteria is how we know it, if we hear the term, is like an emotionally exaggerated state of irritation, right? Something that's out of your mind. Well, you'd be surprised to hear that it is the Greek word for womb. So if you tell someone don't be so hysteric, it's actually a very sexist thing to say. Hysteria was first written down by Aristotle, I think, so that idea that women are mad and crazy because of their cyclical experiences is very old. And it's very important to know this because all of these ideas are alive in our language and in our behavior and also in our science practices. So it was believed that the uterus is walking around in a woman's body making her crazy. So a lot of very questionable treatments were invented. And when do you think it was taken out of the DSM? Yes, it was in there. So in 1980, it was taken out and decided that this is not a scientific reality anymore, hysteria. So again, the whole question is, when we have these hormonal fluctuations that potentially relate to our neurotransmitter systems being modulated, is that per se a thing that needs treatment or not? Or is that something maybe where we can learn from psychedelic studies as well, how we can embrace the process and the uncontrollable nature of these experiences? Because essentialism, as the perfect woman and the crazy woman. This is a poster. Yeah. How old is it? 60 years, so not so long ago. When you prescribe new Mornidine, she can cook breakfast again. So when I hear these things of like, we can give psychedelics to women and then they're happier and function better in our society, I always want to take like one more breath and have a conversation. Because if patriarchy is the setting and we want to integrate ourselves into it, we have to think in a gender critical way. So, especially because women are most likely to be diagnosed like more often with disorders. And gender stereotyping contributes to the women being disproportionately diagnosed with mental disorders and declared as simply experiencing a pathology, but maybe this is also just an organic reaction to an oppressive system. So these questions we have to ask critically and with a lot of sensitivity. And then there's of course also the idea, well, maybe they developed a pathology, but maybe that's also related to the oppression and to the stress they experienced at the first place. So we should be careful with reductionism in science and only look at the brain and not think about sociology or gender or behaviorism, none of these kind of things. Of course, white feminism and gender binary, as I already mentioned, so the whole idea that a healthy woman is when she's a woman, first of all, and is functioning in a capitalist society. Is that really the definition of mental health? Question mark. Further, what I've been also confronted with a lot is the romanticization of the feminine archetype within new spiritualities and psychedelia. So there's also the idea that womanhood is being experienced in psychedelic states and then needs no further work and integration. It's just the ascendance of the goddess that is already perfect as an experience and as a wholesome healing moment. While this can be true, we have to be careful with these archetypal projections because we're not archetypes, we're humans after all, so we're political creatures. I already said this, so there's the history of Western psychiatry is a bit tricky when it comes to women, and it has a history of pathologizing queer people, trans people, people of color, and using psychiatry as a political tool of oppression. So declaring someone as crazy is always challenging. It resulted in over-medicalization and medication and neglecting structural oppressions and also minimizing just the lived experiences and variables of women. Of course, this vicious cycle is upheld by a lack of awareness and funding. What does that mean for psychedelics? Well, there's actually quite a few studies that focus on solving women's health or women's mental health problems with psychedelics. That's why I'm stressing the importance of a critical reflection on psychiatry, because we're looking at ketamine for postpartum depression that's being looked at. It's great. Like, I want everyone who's suffering from postpartum depression to receive the care they need, and ketamine offers great opportunities for this. But it's very important to integrate this with these kind of critical frameworks to not reduce the phenomena of postpartum depression to a cognitive issue. Yeah? Psilocybin and LSD for PMS, PMDD, and menopausal symptoms. It's always big. MDMA for PTSD. That's something where, I'm very sensitive towards, because we need gender-informed care of psychedelic therapists in order to not drug women out of their experiences and potentially do psychedelic or spiritual bypass. And then there's also some trials on psychedelic assisted therapy for eating disorders. But eating disorders, we know, are strongly related to the problems of gender stereotyping. So while it's important and beautiful to advance with the medicines, it's important to do this with interdisciplinary approaches. Yeah, this is a screenshot of an article. Clinical trials will assess if it addresses mood issues. So when you read these things, it's important to think about the wording and the framing of these things. What can help feminist bioethics and psychiatry? Who ever heard about feminist bioethics in the room? You. Yes, not so many. So the good news is, we don't have to figure it all out by ourselves as a psychedelic community. There has been a great body of work of a lot of feminists in the past decades and clinicians who are busy with this problem. We just need to look it up and bring it back into our contemporary context and into the context of psychedelic medicine. So, what are the approaches? One of the ones I really love, I don't know if you read the paper of Brian Pace, who's a sociologist and was active in the psychedelic field. He hypothesized the psychedelics as non-specific amplifiers, really undermining this idea that psychedelics alone can make you a good human and kind of dissolve all the culture and all the politics around you. Then there are the biopsychosocial models of health that can be very helpful, very similar to intersectional analysis. Critically look also at how race and class and ableism plays into account. And then anti-pathology movements. Fast being started in the 60s by a Hungarian psychiatrist and later by Jessica Taylor. She's doing a lot of work at the moment. If you're interested in feminist psychiatry, look up Dr. Jessica Taylor. She has amazing books. I have also some books here for you to pass around, but I have to pass at home. Then we have epistemic restorative practices. So please talk to each other. Talk to each other's unspoken experiences. Ask each other about your non-ordinariness of your non-ordinary experiences. Neurofeminism and social neuroendocrinology is an amazing field. Very progressive field. This is a great work, the gendered brain. Well, this is neuroscience, so this is not cultural science. And social neuroendocrinology has looked at whether the genetics of the gender are really that relevant for cognitive manifestations, or whether the behavior and the environment that is created through the behavior is actually the one that has a greater impact on cognitive developments. So basically, progressive neuroscience confirms queer theory. And another researcher, what's her name? Daphne Joel from Israel, she has the concept of gender mosaic for neuroscience. So it's also a very interesting book to look at. Why do we need to do it? To reduce harm and to become truly progressive. So I believe really that psychedelic science does this correctly from the start, or like with a great ethical appetite for gender, then we can actually be progressive and maybe even guide the way for other psychiatric practices that are developing. So I think there's a great chance if we have these conversations now as the field is emerging. It could be a pioneering element to it. And of course, it's a deepening of PAT ethics. It's something I usually don't show. I just showed it to the Mind Foundation today because I promised to do a deeper dive with you. So this is something that I developed. This is like something that we could apply to psychedelic assisted therapy, which is an approach that I took from reproductive healthcare. So this could involve these 3 simple steps of first, I love the word responsivity. So being able to respond and recognize when there's a gender-related trauma, when it's arising, when it's being triggered, or when it's experienced upfront or in integrational moments. What do we need for that? Education. The second step would be validation. So space holding, stigma awareness, and non-judgmental approaches towards arising issues. I have been stepping into the fields that has been also a lot of people who came to me and were like, yeah, this and this happened in the clinical trial and I didn't know who to tell. Yeah? So we need to teach people and therapists in the field how to recognize these situations and these sensitivities, and how to also space hold and validate their experiences in a gendered context. And then, of course, being resourced. It's very important to know, for example, in the case of reproductive trauma that I will show you in a minute, to know where are the specialists for the integration of a miscarriage experience, for example. So if you have a patient who has a re-emerging or a reliving of their reproductive trauma, for example, which is gender dependent, how do you navigate this? And especially for the integration, where can they go? Where can they find community care? And where can they find a specialist that knows most about the psychology and the integration of these traumas? So again, my vision would be also to do this in an open source way, where we can gather the addresses of the best people we can refer each other to. This is an example that kind of wants to show the complexity if we have a gender-related trauma. I took reproductive trauma because that's something that I worked with a lot. So I kind of want to show here the things that are usually not discussed in therapeutic practices, but that kind of compose the complexity of it. So there's the clinical conditions and the physical distress that maybe is hard to really understand if you have not been undergoing through the experience. So if you have had a pregnancy and you have a male therapist and that is re-emerging, of course there's a lack of reference. So this is one big thing. So there's it can come with very severe physical experiences and distress, and they can be re-embodied during psychedelic experiences. That's one complexity. The other one is institutional betrayal. So, unfortunately, especially reproductive care is not freely accessible to everybody in the world. So, women or pregnant people are very likely to experience some kind of repressive moments that they undergo in healthcare facilities. So that's another thing to be trained on and to be responsive towards. That you maybe have a patient that was mistreated by a medical professional or judged, or maybe sexually harassed. And I'm saying this because the numbers are quite high, so we just have to educate each other on this. Often, this gets internalized because of shame and guilt and isolation. And this is why it then probably arises also in psychedelic therapy, because the strong internalization and the compression of these experiences into the subconscious can pop up and re-emerge. That's why especially psychedelic therapists should be equipped with this knowledge. And then of course the existential distress of these types of trauma that just leave kind of hallmarks or different episodes of a life, of an identity of a person. So to really understand these dimensions is important. This is an example, and I would be excited to replace the middle part and look at other gender-related traumas, gender transition trauma, for example, if it occurs, or gender-based violence trauma, all these gender-specific traumas, especially if we think about how much psychedelics can do for people with PTSD. These are methods. I'm not going to go over it, but I will share them with you if you're interested in deepening a practical understanding of what can be done for intersectional research methods. Feministvoices.com is a very great data bank that kind of lists all the feminist psychologies and psychologists and researchers, and you can look up their theories and their papers. There's a lot out there. And I don't have time now to go through it, but please look it up if you're interested. So this is a summary of what we did today. We have a big gap of data. It's kind of informing the other two boxes because it's also qualitative data. So we lack quantitative and qualitative data about gender variables. And we have epistemic gaps, like if you think about it, name me one famous female psychedelic writer. Yeah, and Shogun maybe, and who else? Like you cannot really recall a lot, can you? So it's important to consider these things, and also when it comes to hermeneutic injustice, also wonder not just female writers, but what are they writing? Are they writing in a way that their reality can be fully expressed and embodied, or is it just another a subordination towards patriarchal norms? So these are the epistemic issues we have to face. And then, of course, psychological patriarchy, something we all collaborate with and is inherent to our meaning-making. How do we integrate this? I already showed you some examples, but it's basically all starts with a question and a conversation, and also questioning the hierarchies. Where does the discourse go? We need more research initiatives. Also, I really want to encourage field research here and just your own initiative, because all of this matters, and all of it is exciting. Gender-aware PhD training is something that's close to my heart, that I really want to see more expanding in the coming years, to really train therapists and bring it together with feminists who have a very practical knowledge of how to communicate with women. community care practices for psychedelic integration, something we can learn from marginalized groups. Queer people have been doing community care for many, many years out of a necessity. So we can learn from women, from queer people, and from many other groups how to do community care in a very nice way. Re-enchanting ethics. I had to do it to make ethics great again. Yes, and also I see a great chance because I think that feminism and feminist scholarship actually has overlapping challenges with the psychedelic field because of the fluidity of genders. So that's a progressive advancement. So have conversations with compassion. Thank you so much.